In the course of my practice, I've encountered a wide array of foot injuries, from the minor to the severe. My name is Dr. Andrew Schneider, a podiatrist based in Houston with over 2 decades of experience. Over the years, I've developed a deep understanding of the intricacies associated with a broken foot recovery. In today's video, I'd like to share my insights and fill the information void that many patients often grapple with during their recovery journey. Before I do, I wrote a book all about foot fractures. I'd like to send it to you for free. You can order it at www.footfracturebook.com. The link is in the description. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. That will help others find this information. Each foot has 26 bones, which all have to work together to support you in anything that you do. That means they have to support you while you're walking, running, jumping, climbing, pivoting, playing ball, and anything else you throw at them. In fact, Leonardo da Vinci was quoted as saying, "The human foot is a masterpiece of engineering and a work of art." Foot fractures are diverse, each presenting its own unique set of challenges. The most frequently encountered type are stress fractures and traumatic fractures. A stress fracture is a crack in the bone resulting from overuse, usually from repetitive activity that puts pressure on the feet. The persistent stress causes the bone to fatigue and ultimately crack. On the other hand, traumatic fractures are the outcome of sudden injuries, such as accidents, twists, or falls. Stress fractures often heal well with adequate rest and conservative medical intervention. This can include wearing a fracture boot and using crutches or a knee scooter. In contrast, traumatic fractures might be displaced or angulated, which means they won't heal properly if left to their own devices. This type of fracture may necessitate more complex treatment like surgery, depending on the severity. Certain fractures, like those affecting the metatarsal bones, can prove more problematic due to their location and the weight they're required to bear. The metatarsal bones, located in the midfoot, play a crucial role in weight bearing and movement, making them particularly vulnerable to stress and injury. In my years of practice, I've seen patients employ a variety of techniques to aid the broken foot recovery. These techniques are less conventional, but many find them to be effective in providing faster and more complete healing. While the importance of adhering to your doctor's advice can't be overemphasized, it's also crucial to note that not every traditional practice might be the best fit for everyone. For example, a number of people find that gentle foot massage can alleviate discomfort and improve blood circulation. That increases the healing process. Some have found solace in alternative therapies like acupuncture, known to provide pain relief and reduce inflammation. It's important to remember, however, that these unconventional methods should be used alongside, not in place of, professional medical advice and treatment. During the process of broken foot recovery, many patients often underestimate the importance of wearing appropriate stabilizing accessories such as a fracture boot or a surgical shoe. In order for your fracture to heal properly, there must be no movement around the fracture site. If you're lax in wearing your boot or take it off when you're walking around the house, it could prevent the bone from healing properly. This will extend the amount of time before your fracture heals completely and will delay your return to activities and the shoes you love the most. Broken foot recovery is not just a physical journey, but a mental one too. The frustration of being incapacitated, coupled with the pain and discomfort, can have a significant impact on your mental health. In my practice, I often encourage patients to find healthy coping mechanisms such as mindfulness meditation or engaging in hobbies that don't strain the foot. Support from loved ones also help to alleviate some of the emotional stress associated with injury and recovery. For patients who have difficulty slowing down and not exercising, therapy often is helpful to give them coping strategies until the fracture is healed and they can return to their activities. Your broken foot is different than any other broken foot out there. That's why a tailored treatment plan is necessary for your unique injury. Generic advice can often be counterproductive to your broken foot recovery. Each foot is unique, and therefore, so should your recovery plan be. As a podiatrist, I prioritize creating individualized treatment plans that take into consideration the specific type of fracture, the patient's lifestyle, their personal recovery goals, and any existing health issues. This personalized approach ensures that the recovery process is as smooth, effective, and efficient as possible. In conclusion, the journey of a broken foot recovery is a multifaceted one, encompassing not just physical healing but also emotional resilience. I strongly advocate for personalized care and encourage patients to take an active role in their recovery process. Remember, your foot is unique and deserves a recovery plan that's tailored to its specific needs. Don't hesitate to seek the advice of a podiatrist to ensure your broken foot recovery process is on the right track. I wish you a smooth recovery journey, and here's to getting back on your feet soon. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. I wrote a book all about foot fractures, and I'm happy to send it to you for free at www.footfracturebook.com. The link is in the description. If you're concerned that you broke your foot, time is of the essence. We'll work with you to develop a personalized treatment plan that helps you heal quickly and get back to your daily activities. The link to request an appointment is also in the description. Thanks so much for watching, and have a great day.